smartphone.
Follow us on Facebook, Twitter, and Instagram. 4, 3, 2, 1.
Oral sex is defined as a sexual act that involves the use of one's mouth, lips, or tongue to stimulate a sexual partner's genital area, and this includes the penis, the vagina, as well as the anal region. Surveys, both locally as well as internationally, have shown us that many people, including young adults and teenagers, don't consider oral sex as being real sex. The thinking behind it seems to be that as long as you're not having penetrative sex, then you're able to preserve your virginity. However, we do consider oral sex as being the real thing. This is because unprotected oral sex can lead to the transmission of various sexually transmitted infections, and that's what I'll be looking at today. Just to be clear, this episode is in no way intended to demonize oral sex. Oral sex has been found to help couples feel better connected, as well as be able to achieve better orgasms than the traditional penetrative type of sex. It is my intention, however, to educate you about the different types of sexually transmitted infections you can find yourself at risk for when you're practicing unprotected or unsafe oral sex. A common misconception is that sexually transmitted infections only affect the genital region. This is false. Lots of infections can be experienced in multiple parts of the body at the same time. Let's start with chlamydia. Chlamydia trachomatis is a bacterial infection that commonly spreads through various forms of sexual contact, including oral sex. Chlamydia can affect various parts of the body in an infected person, including the throat, the rectum and anal region, the genital region, as well as the urinary tract. While chlamydia can be asymptomatic in a lot of infected persons, in some you will present with typical symptoms that include an abnormal discharge from the vagina, the penis, or the anal area. It can also present with pain in the genital region. It can present as a sore throat for those who have participated in oral sex. You also find that it can present like a typical urinary tract infection by giving you a burning sensation when you pass urine, and symptoms such as feeling the need to empty your bladder more frequently than usual. The diagnosis of chlamydia typically involves taking a swab of the abnormal discharge that you've noticed, and we are able to confirm the diagnosis in the lab. Treatment for it is pretty straightforward with antibiotics, but unfortunately for a lot of people they come in very late, and by this stage chlamydia has caused a lot of damage. It's very common to find that people with untreated cases of chlamydia presenting later with pelvic inflammatory disease, ectopic pregnancies, or subfertility or complete infertility. And this is because it causes severe distraction of the tubes and the pelvic organs in general. It can also affect an area known as the epididymis and lead to severe scarring within the ductal system in the testes that interferes with one's ability to release sperm in ejaculate and therefore cause infertility. Chlamydia can cause severe infection in the newborn as it's transmitted from mother to child during the birthing process. It can cause eye infections that can lead to blindness if left untreated, as well as respiratory tract infections that can lead to a very severe pneumonia in the newborn. Oral sex also puts us at risk for the spread of infections that typically present as sores or ulcers in the genital or oral region, and these include herpes and syphilis. Whereas herpes gives you painful lesions, either lips or mouth region or in the genital area, syphilis tends to present with a painless sore or ulcer, and so can easily be missed in terms of a diagnosis. Herpes is a viral infection. It is typically a lifelong infection. We have type 1 and type 2. Once infected, it's common to have flare-ups of the lesions on and off depending on your immune system and your general health. It's important to get treated as soon as you have the lesions breaking out to prevent you spreading the infection to other people. It's also important to inform your partners once you've had a diagnosis of herpes, and inform any new future partners as well so that they can keep themselves as safe as possible. As for syphilis, if treated in time, it can actually be cured and you can continue to keep yourself healthy and protect yourself and your loved ones. If left undiagnosed or untreated, syphilis tends to spread to the rest of the body and can present with systemic symptoms such as body lesions, and in very late stages we have syphilis that affects the brain and can lead to altered mental states and, in the long term, death. It's therefore important to check yourself regularly, given that syphilis sores are painless and you may miss them altogether. Another viral infection that can be transmitted through oral sex is the human papillomavirus, commonly abbreviated as HPV. HPV can cause various forms of cancer, including mouth and throat cancer, genital cancer, specifically cervical cancer and penile cancer, and some subtypes can also affect the genital region by giving us what we refer to as genital warts. Even though the risk is very small, and definitely much less than with traditional vaginal or anal sex, there is a risk for contraction of the HIV virus during oral sex. Something I have to mention is that once you have a sexually transmitted infection, and especially so one that's left untreated, it does significantly increase your risk of contracting HIV from an infected person. Remember that safe oral sex goes beyond just use of condoms. It starts with you. Personal hygiene is a very important part of oral sex. Keeping your genital and oral areas clean and healthy is the first step to take, even before you come into contact with another person. The second step, get tested. Go in for your screening for STIs regularly, especially if you're sexually active, and more so if you have more than one sexual partner. The next step is to ensure that your partner is also tested. When it comes to oral sex to the penis, we advocate for use of condoms, whether latex or non-latex. This is what flavored condoms are made for. They're not for vaginal sex, they're made for oral sex. For oral sex to the vulval or anal region, you can get dental dams, which are thin sheets that are placed on the genital area to prevent direct contact between giver and receiver and each other's body fluids. I hope this episode has brought you a bit more clarity as to your potential risks when it comes to oral sex. I would strongly encourage that you have a conversation with your partner so that you can both consider getting tested and continuing to practice safe sex with each other. Where possible, I do encourage that you have a conversation about engaging in a long-term, mutually monogamous relationship. That way, even after testing, you're both able to stay accountable to yourselves and each other and prevent the spread of STIs. Thank you so much for watching, and I'll see you again next week for part 3 on our STI series. Have a lovely weekend ahead and stay safe.